Hello, and welcome. Today, we'll be exploring a rare and fascinating group of conditions known as heart-hand syndrome. These syndromes link congenital heart defects with abnormalities of the upper limbs, specifically the hands and sometimes the forearms. Join us as we delve into the complexities of these conditions, from their origins to the latest advancements in treatment. The etiology of heart-hand syndromes is primarily genetic. They often arise from mutations in specific genes that play crucial roles in embryonic development. These genes are responsible for the proper formation of both the heart and the limbs during the early stages of pregnancy. While the exact gene involved varies depending on the specific type of heart-hand syndrome, mutations in genes such as TBX5, responsible for Holt-Oram syndrome, are well documented. In many cases, the genetic mutations occur spontaneously, meaning they aren't inherited from either parent. However, some forms of heart-hand syndrome can be inherited in an autosomal dominant pattern, meaning only one copy of the mutated gene is needed to cause the condition. The pathophysiology of heart-hand syndromes is complex and depends on the specific genetic mutation and the resulting effects on development. Generally, the genetic defect disrupts the normal signaling pathways and cellular processes required for proper heart and limb formation. In the heart, this can lead to a variety of congenital heart defects, such as atrial septal defects, ventricular septal defects, and atrioventricular canal defects. In the limbs, the disruption can cause a range of abnormalities, including absent or shortened bones, abnormal thumbs, and fusion of bones in the wrist or fingers. The interplay between these defects contributes to the unique clinical presentation of each specific heart-hand syndrome. Determining the exact epidemiology of heart-hand syndromes is challenging due to their rarity and the potential for underdiagnosis. Holt-Oram syndrome, perhaps the best-known heart-hand syndrome, is estimated to occur in around 1 in 100,000 live births. Other types of heart-hand syndromes are even less common. These conditions affect individuals of all ethnicities and geographic locations equally. Because many cases arise from spontaneous mutations, there is no clear pattern of increased risk within specific populations. The signs and symptoms of heart-hand syndromes are highly variable, reflecting the diverse range of genetic mutations and developmental defects that can occur. Heart-related symptoms may include shortness of breath, fatigue, chest pain, heart murmurs, and palpitations. Limb abnormalities can manifest as absent, shortened, or malformed fingers and thumbs, abnormal wrist bones, and limited range of motion in the arms or hands. The severity of symptoms can range from mild to life-threatening, depending on the specific type of heart defect and the extent of limb involvement. Some individuals may have only subtle hand abnormalities, while others may have significant cardiac and skeletal malformations. Diagnosis of heart-hand syndromes typically involves a combination of clinical evaluation, imaging studies, and genetic testing. A thorough physical examination will assess both the heart and the limbs, looking for characteristic features of these syndromes. Imaging studies, such as echocardiograms, electrocardiograms, EKGs, and chest X-rays, are used to evaluate the structure and function of the heart. X-rays of the arms and hands can reveal skeletal abnormalities. Genetic testing, including gene sequencing and chromosomal microarray analysis, can identify the specific genetic mutation responsible for the syndrome. Family history is also important to assess potential inheritance patterns. While the overarching category is heart-hand syndrome, there are several recognized classifications or types, each distinguished by its unique genetic cause and associated clinical features. We've already mentioned Holt-Oram syndrome, which involves upper limb defects primarily affecting the radial side of the arm and congenital heart defects. Another example is Tabatsnik syndrome, characterized by carpal and metacarpal fusion alongside cardiac defects. Slovenian type of heart-hand syndrome displays thumb abnormalities and septal heart defects. These distinctions are crucial for accurate diagnosis and appropriate management. Treatment and management of heart-hand syndromes are tailored to the individual's specific symptoms and the severity of their condition. For individuals with significant congenital heart defects, surgery may be necessary to repair or correct the heart structure. Medications can be used to manage heart failure, arrhythmias, and other cardiac complications. Occupational therapy and physical therapy can help improve limb function, range of motion, and fine motor skills. In some cases, orthopedic surgery may be needed to correct limb deformities. Ongoing monitoring by a cardiologist and other specialists is essential to ensure optimal health and well-being. Currently, there is no known way to prevent heart-hand syndromes, as most cases arise from spontaneous genetic mutations. Genetic counseling may be beneficial for families with a history of heart-hand syndromes to assess the risk of recurrence in future pregnancies. Prenatal ultrasound may detect some, but not all limb and heart defects, allowing for early planning and preparation. However, due to the spontaneous nature of many mutations, prevention remains a significant challenge. The prognosis for individuals with heart-hand syndromes varies depending on the severity of the heart and limb defects. With appropriate medical and surgical management, many individuals can lead relatively normal lives. However, some individuals may experience significant long-term complications, such as heart failure, arrhythmias, and physical limitations. Recent research efforts are focused on identifying novel genes involved in heart-hand syndromes and developing new therapies to improve the outcomes for affected individuals. Advances in genetic testing and personalized medicine hold promise for more precise diagnosis and targeted treatment in the future.